Hi everyone, and welcome to this brand new series that we're rolling out on probabilities, statistics, modeling, and everything randomness. And my name is Ali Salim, and I am a co-founder and developer at Elsa Health, where at Elsa Health we work with key health stakeholders like government and ministries of health, as well as healthcare providers, health researchers, and technologists to build decision support tools for healthcare providers and individuals alike. As you can see, here's a nice little depiction of myself. Please feel free to visit any of our links here. There's a website, there's the blog, and the health platform that is currently in very, very early beta. So the more people that can try it out and break it, that will be great. Just make sure to reach out on the contacts here to request any changes, or if you find a bug, please do let us know. All right, we'll jump right in here. And I'll just introduce the series a little bit. By the way, I'm using Excalibur in the background. Big shout out to Excalibur, one of the tools I actually cannot live without. So this series is going to be on modeling, and all of this content will focus around everything related to modeling, or everything related to modeling simplified. We'll be creating models that represent our complex world that we live in, and we'll make sure that all the content is approachable, simple, and easy to digest. Okay, the key person that we're trying to focus on for this content is healthcare providers, although others will still benefit from the content. But we want this to be key reference material for anybody working on developing health algorithms over at our health platform. And I think I might have it open here. Yes, here it is, where we're trying to build open health algorithms on open source software with a large community across the world. And we'll try and produce at least one video a week. There's no promises around that, but we'll try our very best to get this content out there. And just to outline the series a little bit, the series is needs and value based. That's how we will create the content, and everything is agile and iterative, sticking to the true startup spirit. We only know the first 4 videos of the series, and the rest of the videos or content will be determined by the viewers as well as the users of the health algorithm platform to let us know what is missing and what needs to be developed that will be helpful for them. So the first one, which is this one that you're watching, is the introduction to modeling and simulations. And after that, we have some ads there from Brave. And after that, we will deal with randomness. We'll try and look at how we can contain all of this randomness that exists all around us. We'll talk about random variables for 2 videos. And then we'll, based off of the comments on videos and social media reposts or emails that we get, we can choose what to come next. Okay, so jumping right into the content, let's introduce modeling. Okay, it's very exciting. And what is a model? So let's start with the definition of the word model. A model is it's simply a representation of reality. Now, since reality is very complicated and complex, and noisy and overall just very, very difficult to measure. There's always all of these measurement errors when you're trying to record what the universe is trying to say through data. And we create a model to represent this universe. And because of all of this complexity, we have to create models that are very specific to a single or a small number of purposes. And it becomes an abstraction of a reality. And this is called information hiding, where we simplify reality and abstract away all of the things that we don't need for our specific purpose, and we end up with a simple model that we can use for our needs. And it's also very beneficial for models to be simple, because simpler models process faster, they process cheaper. You don't need so much compute power to run a simulation and to process queries and data. And I use the word there, simulations. Let's look at what simulations means. After you develop a model, so I've devised this little model, when I query it or when I ask it a question, the results that it produces are what we call simulations. So as you can imagine, since the model is an imperfect representation of the world, the simulations are also imperfect depictions of the data that we would otherwise observe in the world. So if the world or the universe has an internal model that is very complex and hidden from us, and that model generates the data we see every day, then our simple model that we develop will generate data that is approximate to the data that we see in the world. Now that data that's generated is called a simulation. And we see models all around us. Models are used for disease spread and transmission. Epidemiology folks use SIR or SEIR models or agent-based models day in and day out to try and control pandemics like the one we're currently getting through. Models are used in drug release processes, so trying to predict or trying to understand the release cycle of drugs the moment you ingest it, how long until it reaches optimum levels in your bloodstream, how long until that level drops and you need to take the next pill, as it be. And if you remember in high school, I'm sure if you've taken chemistry, you've come across the molecule or simple elements or the chemical formulas that you dealt with. They are all models of what is of what we're trying to represent. And this type of, even though this is bigger than a real molecule, this is still a simplified version of what a molecule actually is. And this helps us understand it and interact with it. City planning, basically any kind of planning in the modern day and age requires you to create certain models that will help you visualize and interact with the thing that you're trying to model in a cheap and effective and cost-effective way. Okay, so are these things useful? I'm sure we're making a whole series on it. You can already guess that they are. And there's a famous saying that goes, all models are wrong, but some models are useful. And this is very true. And because a model is a simplification of reality, it is not an accurate representation of reality, and thus it is wrong, or rather inaccurate. But if you model the specific problem that you're trying to solve or context you're trying to understand, you're able to create very, very useful and accurate models that you can query and ask questions and observe intervention results and all of that nice stuff that's happening there. And these models, let's talk about where we use them. We use them to estimate values, so this is similar to prediction. At Elsa, we use models to try and predict the cause of a patient's symptoms or signs. A patient walks in with a cough and a fever. We try and create simulations of patients with coughs and fevers, and we try and look at what % of them at this time of year, in this geographic context, and in this demographic, what % of this simulation has malaria, what % of this simulation has pneumonia, and we can, based off of this, we can calculate the probabilities and the likelihood that a patient has malaria as opposed to pneumonia, or vice versa. We also use them to develop an understanding of a system. So simulations can be very helpful when you're trying to get answers to questions that are hard to ask in the real world. So imagine a situation that is extremely difficult to observe, or once you observe it, it's very difficult to replicate it. Models can help us basically observe and replicate it at will. So once we model the situation that we're trying to observe, we can have it run and produce simulations for us as often as we'd like, and we can change some of the parameters and produce more simulations. And as we observe these results and data from the simulations, we're able to develop an understanding of what is actually happening in the system. Another key use of models is in experimentation and testing out of policies, strategies, and interventions. Some examples here are, will mosquito nets be effective as an intervention? I can model a population, model the malaria prevalence in that population, and introduce mosquito nets to see how effective the intervention will be. in the simulation setting. I can also ask questions like how often will a patient with pneumonia develop a productive cough. So what I have to do is model a patient with pneumonia and run simulations maybe a couple of million times. That might be too much, but depending on your use case, let's say 1,000 times, and I can look at what proportion of those 1,000 pneumonia patients actually develop a productive cough. And thus I can get some insight into what is happening inside the body. Okay. Lastly, we will look at models and simulations. An example. This is a very famous example. It's called the Chinese restaurant process, also known as the conference seating process. And just to lay some context here, imagine you walk into a Chinese restaurant and there are tables, and each table has a different number of people seated and seated around the table. And we want to model what is the likelihood that a person who walks into the Chinese restaurant will sit at table A versus table B versus table C. So we're trying to create a model of the Chinese restaurant and where a new person walking into it will choose to sit. We'll make some assumptions, and these assumptions are what cause models to actually be simplifications of reality. And the first assumption is that popular tables are where everybody wants to be. So everybody who walks in is more likely to want to sit at the popular table or the table with more people. And we will also assume that tables have an infinite size and you can sit infinite numbers of people. As you can already tell, these two assumptions don't hold in all cases, but we are simplifying reality to observe a very specific thing. And I'll go over to this tab here. The link to this will be in the description. I'm just going to go ahead and refresh this. Let's refresh this. Okay, so we have 1, 2, 3, 4, 5, 6. We have 6 tables in our Chinese restaurant. You can see them, these large blue circles. And when someone walks into this restaurant, table 1 and table 2 and 4, 5, and 6 all have one person at the table. Table 3, on the other hand, is very popular. There's already people sitting there. And you can see down here there's some probabilities and with respect to the number of participants at each table. And we'll cover probabilities in the next video. So let's assume someone walks into this restaurant. Where are they likely to sit? And we can head over on the left here, and we have some options here. If one person walks in, we'll click on this Add Participant little icon here. As we might have predicted, they will choose to sit at table 3 because it's the most likely one. But what if this whole thing is broken and everybody just sits at table 3? We'll do it again a few times. Oh, this one went to table 2, table 6, table 3, table 2, table 6, table 3, table 3, table 3. Table 3 is very popular. And you can see as we continue to make more and more simulations, we get more and more data that we can observe and more information, as well as there's the gap between the tables that have people on them, the popular tables, and the unpopular tables keeps on widening. And what we'll do here is we'll change this parameter here and start afresh. Let's assume now we're at a restaurant where you walk in and each one of the tables only has one person sitting on it. And we will add one person. One person will walk into the restaurant. They chose to sit at table 6. Let's add another person, table 6 again, table 6, table 6, table 2. So these are simulations, and this is how we expect the world might work under these assumptions. Table 6 is getting very popular. And I'll just add 100 people so we can quickly observe it. Now, every person who walks into the restaurant wants to sit at one of the popular tables. Although it's not impossible that someone walking in might want to sit at one of the other tables. It's just unlikely, as you can see from the data. And over time, we see this everywhere in the world around us. Over time, the more attractive tables get more interest to them, basically. And that's what we're seeing here. I'll just refresh that and try that one more time. This time I'll introduce 1,000 people. and we'll watch the numbers change. Maybe I'll fast forward this a little bit. There it is. So if you're unfortunate enough to not pick up a large number of people early on, you are likely going to end up as one of the unpopular tables over time. Okay, I'll leave a link to this in the description. Please check it out. If you find it interesting, do let me know in the comments. And that is all for today, for this week actually. And thank you all very much for sticking with me. This has been one long video. We're working out the kinks and trying to figure out what is the best way to deliver this content. Hopefully this works out. If there's any comments, suggestions, any feedback at all, please put it in the description. I'll read every comment, not in the description, sorry, in the comments. I'll read every comment and respond to any that need responses. And hopefully together we can create new content for the upcoming videos. Thank you very much.